Ladies and gentlemen, welcome back to our second part of discussion today, whereby we were discussing about types or treatment modalities available for the treatment of fibroids. And before we continue, guys, thank you for the support you have shown me. Thank you for supporting this my channel. Thank you for the far you have taken me. Continue keeping the support on and make this channel a success. So let's discuss about types of myomectomy, which is one of the treatment modalities used in the management of fibroids. We have three types of myomectomy. One, we have open myomectomy. This is whereby the fibroid is removed through an incision on the abdomen and is mostly used for larger fibroids. Number two, we have minimally invasive laparoscopic myomectomy, which involves several small incisions or standard laparoscopic myomectomy, or one slightly large incision, or which may be called single port myomectomy. Number three, we have hysteroscopic myomectomy, which involves removal of fibroids through the vagina using a camera and no incisions involved. It's used for fibroids that protrude into the uterus, for example, submucosal fibroids. Let's come to the next mode of treatment, which is uterine fibroid embolization, or UFE. This is a procedure of treating fibroids that involves all whereby it's performed by interventional radiologists. And in this method, a thin catheter is inserted into the artery at the groin or the wrist through an incision size of a pencil tip. Small particles like grain of sand are released through the catheter into the fibroid blood supply. I want you to get this. In uterine fibroid embolization, it's a procedure of treating fibroids performed by interventional radiologists, whereby a thin catheter is inserted into artery at the groin or wrists through an incision size of a pencil tip, and small particles like grain of sand are released through the catheter into the fibroid blood supply, blocking small blood vessels, which deprives fibroid nutrients. It deprives the fibroid nutrients. I hope you get that. When the fibroid is deprived of the nutrients, it softens, bleeds less, and shrinks in size. Note this: uterine fibroid embolization, or UFE, is non-surgical and minimally invasive. Non-surgical and minimally invasive. Uterine fibroid embolization is not recommended for the following group or type of people. Or who are the people who are contraindicated or should not be exposed to this kind of a treatment? One, people who have active pelvic infection. Number two, people who have uncorrectable bleeding. People who have uncorrectable bleeding problem. Number three, people who have endometrial cancer. People who have endometrial cancer. Number four, people who have larger fibroids. Number five, people who wish to preserve their fertility. People who wish to preserve their fertility or planning to get pregnant in future. people who preserve their fertility or planning to get pregnant in future. Number 6, people who have larger uterus. Number 7, category of people who are contraindicated to this type of treatment. People who have pedunculated fibroids. Pedunculated fibroids, or a fibroid that hangs by a stack. This marks the end of our discussion today about myomectomy, and in our next video we'll be discussing about ultrasound guided radio frequency ablation. Ultrasound guided radio frequency ablation as a method of treating fibroids. Guys, thank you for your time. Thank you for supporting my channel. Thank you for the subscription. Let's continue supporting this channel, and I know with your support we are going far. Have a good evening.